Atrial fibrillation is a very unique, ubiquitous arrhythmia that has, has significant interactions with central nervous system, autonomic nervous system. So what happens in the heart sometimes can be regulated by what happens in your brain through your autonomic nervous system. So that's where the entire gangliated plexi and other things really come into play here. So there is a significant amount of data, and there is actually a lot of patients who can clearly tell you that whenever they're stressed out, whenever they're upset, their episodes of atrial fibrillation trigger in, and they kind of sustain and go from there. And stress reduction and relaxation seems to really help a lot of patients. So when you really look at the source of arrhythmias in human beings, the central nervous system actually has a lot of components, and anytime your body is under stress and anxiety and fear, there are components of your brain that are activated, which then transmit impulses through your autonomic nervous system, triggering arrhythmias both in the atria as well as the ventricles. So these are well-defined phenomena that have been well studied. So now we clearly know that the central nervous system has a role to play on the cardiovascular system. So then if you really look at various strategies that you could use to really impact and modulate the central nervous system, you have things like the biofeedback and several other things that you could volitionally do to impact your central nervous system. And I thought yoga would be a very interesting, very practical tool to really look at it. And in fact, the inspiration for my study actually comes from one of my own patients who actually can volitionally stop her AFib episodes by doing breathing exercises and doing 15-20 minutes of yoga, which I thought was amazing. And I felt compelled to study that in a more scientific fashion, that entire concept. So what we did in this is we took a bunch of patients who have paroxysmal atrial fibrillation, and we studied their arrhythmia burden by giving them heart monitors. So, and then we recorded the number of episodes they've experienced and the severity of symptoms they had. And then after 3 months, we put them on a regimented yoga program which involves the regular asanas or the poses and then the breathing exercises, which they did for at least 3 times a week for a span of 3 months. And then during that period, we monitored their arrhythmia burden and then looked at their overall symptomatic and asymptomatic episodes. So what we found was about a 35 to 40% reduction in the number of episodes of atrial fibrillation. And that effect seems to be directly proportional to the number of episodes of yoga that they did. So I think this definitely is very promising because it is the most inexpensive and the most non-invasive way of actually affecting your clinical profile, and it really helps to improve the symptom burden to a great degree. Their quality of life seems to be significantly better. Their anxiety, depression scores also seem to be significantly better. So I would say, in addition to everything else that you guys do based on the recommendations of your doctors, you should definitely think about doing at least 30 minutes of yoga every day to really keep your AFib burden under check. Right. And we actually have an educational DVD that we're going to bring out through the Journal of Atrial Fibrillation for patients to really help them to figure out this concept of yoga for atrial fibrillation. Thank you. It is quite possible, although we don't have any data to support that. We're working on that particular issue. But it conceptually makes sense because when you decrease the number of, so if you really look at why patients move from paroxysmal to persistent atrial fibrillation, AFib begets more AFib. That means if the number of episodes of AFib increases, then the amount of systemic inflammation that sets in makes your AFib more frequent, as a result of which there are some structural changes that happen in your left atrium, and as a result of which your paroxysmal AFib becomes more persistent AFib. So yoga can be actually a very good intervention here because yoga reduces the number of episodes of AFib. So that means it is decreasing the probability of you developing more systemic inflammation. And it is also clearly established that doing yoga reduces the overall inflammatory burden on your body, and so which I think can also result in positive modulation. So yoga decreases blood pressures, yoga decreases the sympathetic surge in your body, so all of which are pro-inflammatory factors and which promote evolution of the substrate from paroxysmal to persistent. So I think it makes absolute sense.
Absolutely. Thank you so much, Dr.
Thank you.
Lacqueretti, for sharing this very interesting information with us.